Don't be tricked by all the trends. Today, we are going to discuss all the top questions people ask on peptides. So stay tuned for this one. You'll want to stay till the very end because we're hitting all the top questions. Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Golombieski, family nurse practitioner here at Revitalize MD, and today we've got a spooky fun podcast on peptides.
Yes, like fall into health in the peptide world as well. So,
right, all the changes happen in fall. So,
yeah. Well, and I think that people come off the summer and sometimes they're a little healthier and active, and then the days start getting shorter. It starts getting cooler. So people tend to fall off on their health. So instead fall into the health on or in this fall. So that's what we're going to talk about. Some like peptide trends, some spooky,
what peptides are, what the main categories for peptides are, and what people are asking about peptides. We get so many questions about peptides, so this one is for you guys. We're going to answer all the top questions that we hear on a regular basis. So let's start with peptides in general.
What are they? So peptides are amino acid sequences in proteins. So proteins are just a little bit bigger. Peptides are amino acid sequences, so not as many amino acids or as big as a protein, but proteins break down into peptides and then amino acids. So basically, it is functioning like a neurotransmitter or a hormone in the body, giving the body back what it needs to repair or something else. So peptides are for multiple different reasons, and that's what we're going to get into, the peptide categories that we'll discuss, the main categories we'll discuss.
So really, when you kind of break down peptides, there are so many out there, but really there's 5 main categories, really, when you think about it. So it's healing and recovery, beauty and hair, sexual wellness, body composition, longevity, and then immunity. And that kind of encompasses just about all of it.
Yeah, no, it does. And some crossover between some of them. But again, one of the frequently asked questions is how many peptides are there? And we don't get a frequently asked question of first peptides, but the first peptide to market was insulin. So, way back in the 1930s, we knew that peptides worked. It is a sequence of amino acids natural to the body that works. So this one was replacing something that wasn't being produced in the body. So insulin first went to market. So there's about 150 in research right now and about 80 approved FDA peptides.
Think about that, right? Mm-hmm. That is a lot of peptides. Peptides are the coolest thing. There's like a peptide for everything.
Yes.
And like we said, they kind of fall into these different categories. But the cool thing about peptides is they do cross over into those. So one peptide isn't just for body composition. It can also have an immunity benefit. It can also have a beauty benefit. So they do kind of play a little bit in all those arenas.
Yeah, no, and I love that part about it. But they do something or give the body back what is needed. And so they're beneficial for that reason. And there's a lot of controversy around peptides. So what we're going to do today is really just talk about those top peptides and top questions that are asked on those peptides. So what are the top peptides for healing and recovery?
I think probably the one we get the most questions about, that we hear the most about, is BPC 157.
Yes. Yeah. And that one is a top favorite of almost everyone that has used it.
It's my favorite peptide.
And probably on the hit list as well.
I love how you just slid that in the hit list.
And on the hit list. But we'll talk about that at the end too, like why and what kind of separates, that regulation on peptides and compounding pharmacies and when something can be, compounded and not. But the top healing ones, again, BPC being the first, TB 500 is another really common one. And
we hear a lot about that one too.
Yeah, and TB4 used to be one of those as well. Mm-hmm. But again, that falls into the immunity one as well. So BPC 157 is probably the top healing and recovery peptide. And you can go online and see people talk about just how beneficial it has been, whether it's a short, acute injury or whether it's a longer term. So somebody can come in with like an elbow that's acutely hurting them, and then they basically have had some chronic back pain and both get better. Yes. And across the board, that has been the case. But some of the top questions on BPC.
Yeah.
So does the capsule form work? That's a top question. And again, I would say that capsule form is something that we would use only if it was GI related and that we
Yes.
were treating something GI. Otherwise, a injection and a sub-Q injection is the way to go, and that's going to get you systemic absorption. One of the other frequently asked questions on BPC is
Safety. How safe is it?
Yeah. Well, and there's another one that I was even thinking, but yes, safety.
Long-term use. Like, is it safe and can we use it long-term?
And so again, I don't think you're going to get any long-term studies on the peptides as of yet. And again, there's a lot of them in research and being developed right now, but not yet FDA approved. And then there's 80 that have been. And so long-term studies on something that might be natural, so you may not find big, huge randomized controlled, but the safety data has been there and there's no reported safety concerns that we could find on BPC.
And the animal studies are really strong.
Yes. Yeah.
So there are a lot of animal studies out there that you can look at.
Yeah. And again, so that's one of those that the safety has not been documented to be an issue. But I think that, there is, some other things such as does it have to be injected close to an injury?
Oh, yeah.
Was the
We
one
get that
I
all
was
the
thinking.
time.
Yeah.
Well, that would make sense. You were talking about oral and injectable.
Yeah.
And I prefer injectable the majority of the time, even for gut issues. We just see better results. But if we're going to go oral, it definitely should be of the GI nature. So yeah, it doesn't need to be local to your injury.
Yes.
It's systemic.
Yeah.
There's really no need. It's going to work. If you have a bicep tendon rupture, you're probably going to have a higher risk of causing injury to yourself trying to inject in the area than you would if you just injected it sub-Q, because it is systemic.
Yes. And again, so sub-Q or IM frequently gets, confused. And again, all the peptides are small needles. And so it's sub-Q. So it's a liquid and it's a small amount. So those can all go sub-Q. But that's going to be either IM or sub-Q is going to be systemically absorbed and work everywhere. And we actually did. So it's anecdotal and some people say, yeah, they get better the closer you inject to the elbow. Again, I think there's so many questions about that, just like how long did you compare it to the other side? Did you only inject close to the injury? But we had one guy, and he's on a video testimonial that was talking about BPC way back, and he had bilateral knee pain, and we injected it closer to one side, and they both got better in the same time. So again, to me, it only makes sense that you're injecting it systemically. It goes everywhere, and people do get improvement in the acute injury and improvement of the long-term pain that they're having. So to me, it works systemically, and you don't have to inject it close to the site. But if you can do that without injury, have at it. That's okay.
If it makes you feel better.
Yeah. And so that was one of them. Again, I think that people have asked about BPC, related to sexual wellness and Peyronie's and, all kinds of things, injecting it by, Peyronie's and scars. And that isn't something that we have used or plan to use. But also post-lycocytic procedures was another common one.
Yes. And
we don't do that either. Although it's, great for healing and collagen, there's some other things that you can do instead that are beneficial, and even the other peptides you can use post-aesthetic procedures.
Yeah. So could it help with the collagen pathways because of those pathways? Yes. But there are better peptides out there.
Yes. And then what kind of effects have you seen? Side effects? What are the side effects of BPC?
So other than potential irritation or redness at a site or bruising from the needle, I don't want to jinx it, knock on wood. That's not wood, but we haven't seen them.
Yeah, no, that is.
We haven't. I have not had any adverse effects with BPC. I've heard people getting a mild headache, but I don't know.
I haven't seen it.
Again, we're just not seeing it.
Yeah. And we've been doing peptides for years. Again, it's in flux with what we can do based on, the compounding pharmacies that we use. So that is in flux. But we have in the past used a lot of BPC. And I have never seen side effects.
Mm.
It doesn't interact with medicines. You can actually use it. And we have, in the pre-op, post-op, and perioperative period without issues, including,
Yes.
one of our staff that had a trauma way back and significant trauma. Um, and so that's okay too. And I think that how long to effects, I would say 2 weeks. Usually you're going to start to see effects and maybe even sooner than that. How long do I need to stay on it to really give it a trial? And I would say 60 days at least.
Yes.
And is it something we can use long term? And is the safety there? And I would say that the safety concerns have not been documented and it doesn't interact and people can use it long term if they want. And again, these are peptides questions. These are questions that we hear and we're asked and we're answering based on,
What
history
we
of use.
see
Yeah.
and our expertise.
Yeah.
So I tell all patients, if you're getting on BPC, commit to 2 months. 1 to 2 months,
60
you're
days,
committed
yeah.
to really see a difference.
Yeah.
But like Dr. Durst said, most patients notice as soon as 2 weeks.
Yes. So the next one up, so that was like almost the healing, like hex, if you wanted to do
Yes.
the Halloween
Oh,
stuff
yeah,
with
the little
it.
mini potion.
Yes, yeah. But the beauty brew, like being one of those as well. So that is another of one of the big, areas of or categories of peptides is beauty and hair. And so what can you use for beauty and hair? And again, the copper peptide serums, copper, GHKCU for face and for hair frequently comes up. So we get
Or
lots
injectable.
of questions related to that. Yes.
Typically, we get questions about the injectable, and people don't realize that there are other options. We have a fun little compound for topically for the face, neck, hands, and then also topically for the scalp for hair regrowth. So what does the copper peptide help with and do?
Yeah, and so the copper peptide is great. And it's a small one, so just 3 amino acids, and it's hooked to a copper molecule. And so for me, it's like a lot of repair, collagen, elastin, and even hair stimulation, fine lines and wrinkles, pigment. So really used a lot in beauty. And like Faraday said, we have a skincare compound with a copper peptide in it that's used topically, but it also has 4 other ingredients in that are great for skin rejuvenation. And so that is one of the things that we frequently get asked is, can you use the copper peptide topically after a laser procedure? And the answer is it depends, really.
Yeah, I was going to say, I was wondering if you're going to go all in and say yes.
No, because I think it depends on how it's formulated because you have an open area. And frequently, if you have microchannels, you want to be careful of what you're putting into the microchannels.
Yes.
So I usually do not recommend active ingredients within that 24-hour period, although most of those microchannels close within 4 hours. So yeah, I would say it depends. There are some medical grade, potentially copper products that are saying that, but for me, you can use it, but not in that immediate post-procedure time frame. So,
and then how fast does it typically work?
Well, typically you're going to, again, see effects almost immediately, just with some improvement, blood flow and thickening and hydration, but 8 to 12 weeks usually is what so you want to stay on that skincare cream for at least, again, 2 months, maybe going on to 3 months, and you may actually like it so much that you stay on it indefinitely, which is okay as well. So is safety there with the copper? And I would say yes, definitely. Topically, we haven't used it a ton from an injectable standpoint because, again, it kind of comes and goes in availability.
Again, peptides are very controversial right now. There's a lot circulating about them. So again, we're answering our top questions and what we utilize the most and what we can give you the best advice on.
And is the copper peptide natural? And it is to like serum, gastric juices, urine. So it is a natural substance and it does decline with age, which is why it will improve collagen stimulation and elastin and hair growth. So just another one, does the copper peptide work with hair growth? And the answer is yes.
I've personally used our topical for hair and I saw a big improvement with that and some other the regenerative treatments and really enjoyed it. It was great.
Yeah. I love it in the face cream.
Yeah.
And
And that's
so,
another one that just patients rave about.
yes. And it has estriol in it too, which is a great skincare product or ingredient. So again, one of the other areas is even just muscle building and body composition changes. And so that's looked at more of a wellness and longevity. But muscle building body composition is the main thing that we see. And the ones that fall into that category, again, I say Ipamorelin first generation growth hormone releasing hormone simulator, so it actually acts like growth hormone releasing hormone. Ipamorelin first generation CJC 1295, second generation Ipamorelin third generation. Again, the only approved product there would be Ipamorelin.
And
And Ipamorelin, yes, sorry. And then Ipamorelin and the HPs, like the 2 and 6, are growth hormone releasing peptides, not growth hormone releasing hormone. Those also fall into that category with the growth hormone releasing peptide, the GHRPs 2 and 6, having more hormonal effects, so probably not always tolerated that well. Ipamorelin more frequently people do well with, and it's usually paired with some of the other growth hormone releasing hormones.
And I think what's really important when we talk about those peptides, these are not growth hormone. They're not human growth hormone. They do not directly affect, they are not directly increasing growth hormone, or we're not giving growth hormone. We're allowing your body to increase its own natural production of growth hormone.
So the question leading up to that is it growth hormone? So that is a frequently asked question.
Is it the same of HGH?
Yeah.
Is this HGH? It is not HGH.
Yes.
They're very different.
Frequently, if people come in looking for HGH and we have conversations about why this is different and why we prefer this, then they actually are okay with just doing the peptide, the growth hormone releasing hormone. So again, if in the body you have like you have the pituitary that has growth hormone releasing hormone, and then it actually releases growth hormone, goes to the liver, forms IGF-1, and does all the effects. So all these peptides do is stimulate the release of growth hormone, your own release of growth hormone, and it doesn't shut it down. And so that's the difference. And so it isn't growth hormone directly, which will actually shut down your own system. And it would be a great drug because it does all beneficial stuff, body composition, brain clarity, insulin resistance, lipid profiles, blood pressure, all kinds of good things, but people use it in excess. And so therefore it causes problems.
And it gets on a ban list.
Yeah. And somewhat illegal, but yeah.
Yeah.
So, but anyhow, so again, is it the same as growth hormone? Does it shut down your own system? Is another frequently asked question.
Well, this will not. These peptides won't, but growth hormone will.
Yes.
So does it shut down your own system? No.
Yes. Does it spike your appetite? That's another one.
So that I feel like changes from patient to patient. Like some patients say they don't see any difference, and then some say they see a little bit of a spike. I think it's very minimal.
And I think it's because we don't use the GHRPs.
Yeah.
And 2 and 6 have a big increase in appetite. And so probably not as much. And I always think that they acclimate when they get that, kind of like a testosterone optimization.
Yeah.
They kind of get hungry, but nobody gains weight. And then they acclimate to the effects.
I've had some patients that have said, yep, my appetite increased, but like Dr. Durst said, it kind of settles, but it's minimal. But then I have others that say they never noticed a difference in their appetite, that was never something that spiked on it. So I think that varies person to person on how you respond. And then what your dose is, how you're dosing, I think plays a big role in that as well.
And then how long before I see results? That's a common question.
So that, we have our little show notes and all the things, and it says 2 to 3 months, but really for some people, it can be a little bit longer to really see body composition changes. And it depends, what are you doing? Are you putting in the work? Are you sleeping? Are you getting recovery? Are you working out? If we're not doing anything and expect to take these and have muscles in 2 months, that's not going to happen. This is just going to help you support to build.
So I would say this is always long game. So
Yes.
there's like, again, peptides that can be used for a more rapid weight loss, with still maintaining muscle. But with this, I think this is long game. And
3 to
I say
6
six
months.
months. So
Yeah.
that 3 to 6 months are
Yep,
the
3 to
biggest
6 months.
strides. And again, I used it way back, starting way back. And when I did, again, it was long game. So like within that 3 to 6 month period, I noticed the biggest strides. But if like women are looking for, you get, muscle that decreases with time. You have some fat that changes. You have some skin that changes. So there are definitely body composition changes as women hit perimenopause and menopause that significantly improved with my use of CJC, which was like 5 years ago for the first time.
Yeah.
Like, so anyhow, but long game for sure.
Long game.
Long
So
game.
yeah, so that's why I smiled when I kind of looked
Mhm.
down, because it said 2 to 3 months, and that might be what is circulating, but really what we see in practice is 3 to 6.
Yeah. Body composition, 3 to 6 months.
And you got to be
I say
doing your
6
part.
months on it for, and yes, and doing all the other things, creatine, protein, and in weight and resistance training.
Whole body collagen.
Yes. And so I think those are like the top ones. Side effects, again, the side effects with CJC are a little more flushing than you would get with BPC. So we get that. And of course, reaction site potential. But I think that flushing is the most common.
Yeah.
That I've
Potentially some
seen.
ringing in the ears.
Yeah.
Short-lived.
And the quickest effect that I've seen with patients is that they notice an improvement in sleep fastest.
Yes.
So body composition, long game, but sleep is faster. And then can you be on it long term? And again, I think that there's no long term studies, and most people are cycling on and off. And you can cycle with where you're doing like maybe a 5-day on, 2-day off. Some people will then come off for 3 months. But again, some of these are in flux right now. And so, but those are just questions asked and
Yes.
answers.
And I think that depends highly on what you're doing, your dosing, what your goals are, and working with a provider that understands the peptides in your goals.
Yep.
To keep you safe.
And are frequently monitoring and following body composition, following improvement. There's lots of labs to do with these. So there's things to do. So basically, the other one is sexual wellness, peptides, and the top
The
sexual
love
wellness.
spell.
Yeah. The love spell for Halloween, right? So PG141 is the main one there.
Yeah. And this is a fun protein or peptide. It's a lot of fun. It helps increase libido through neurological pathways versus through blood flow, which is what we typically see in sexual wellness medications.
Yeah. And so I think that this one, so what are the side effects of, can it be used in men and women?
Yes.
So that is one of the main questions. And yes, the answer is yes.
But FDA approved only in women.
Yes, but it does work for men too. And libido for both, but sexual function for both too. So libido, I look at more of a systemic, response where you have an increased sex drive, but then harder erections and better orgasmic strength for women. So that is for both. And again, how what are the side effects with PT141?
Probably the most common side effect we hear is a little bit of nausea, and that is almost across the board, but it is short-lived. It is very well managed and tolerated, but that's probably the biggest one.
Yeah, I would say, and most do acclimate. I always say they'll love it. Like almost everyone loves it, but when will they love it? And that's based on some nausea and just timing. So those are the two big things. And again, they usually get used to the nausea, but not recommended for like special occasions for the first time. So if you did get nauseated, and then
it's a fun peptide, but you got to know it before you use it.
Yes, you got to play around with it a little bit to see timing and when the nausea resolves for you. How is it used? Like what route is the best?
So this is another one that has 2 different routes. It can be a nasal spray or it can be subcutaneous injectable. We do a lot of injectables in our office. That seems to be the most preferred.
Yes. Yeah, injectable. I haven't had much success with the intranasal, to be quite honest. So
I've had a few patients like it, but across the board, the injectable just is a little bit more tried and true.
yeah. And can it be used long term? We don't get that question frequently, but I don't think it's meant to be used long term. It's
No,
meant
it's
to
more
be
an on
PRN.
demand.
Yes. And again, the side effects are, the usual. But I would say that does it help with just the key point and takeaway is it helps with the function. So orgasmic strength in women and erectile strength in men, not just libido, but orgasmic strength too.
Yeah.
So those are definitely some frequently asked questions. And can you use it with other things like Viagra, Cialis, hormones? And the answer to all of that is yes.
With caution.
Yeah, under medical guidance, like
Yes.
by providers that are very trained in peptides and in sexual wellness. So
Less is more when we don't want negative side effects. So going low and going slow.
absolutely. So the last category, and one that we probably don't hit on as much, is immunity and immune modulation. And the top peptides there are TB4 and TA1.
Yes.
And those are the usual ones. Again, both of those kind of intermittently been pulled, like they were being used in COVID, and so they were pulled back then. But I will say that those have been, like, again, almost life-changing. And we had one patient with CML with a chronically elevated white blood cell count in the almost 30 range, which at any point can convert over to an active cancer. But just with even hair treatment of TB4 and doing some of
that's
those way
crazy.
back, like his white cell count came down to the normal range and he was doing great with it. So those are great immune modulators for different reasons, but TB4 has great studies for hair growth.
I know.
And injecting it in the scalp directly for hair growth and then also getting some immune modulation was like a win-win.
And that's one that is immune and beauty.
Yes.
It hits both, but known more for immunity. But we used to use it a lot for hair.
And some of them also, like Care Factor for the topical, has the TB4 and it from a topical standpoint. So anyhow, yes, those are the main peptides, frequently asked questions. So let us know if there's anything we didn't hit, if you have a question about another peptide or a question about these that we didn't hit, because of course we're willing to deep dive into anything wellness or sexual wellness.